forward to this.
Start now too.
Okay, cool.
Okay, great. Well, I think we can, in the interest of time, I don't want to, waste too much of Dr. Solez's time. I don't think he needs any introduction. He's the founder of the Banff um, Foundation. I'm not going to do the introductory slides I usually do to give him more time. So I think I'll just go ahead and turn it over to him and let him give his talk, and then also that'll give more time for discussion at the end. So thank you so much
Okay,
for joining. Thank you.
great. Thank you very much. So we're talking about AI optimism in nephrology. Um, and I'm going to bring you right up to date with sort of what the situation is now today, but I'm also going to um, about 6 or 7 slides in, um, give you some idea of what happened at the New Delhi meeting in February, where Agnes Fogo and I debated about whether we still need renal pathologists and nephrologists in the era of AI. Um, yeah, so there's a lot to talk about, and maybe one of the most surprising things, and this has been true for a long time. I've been working on this general area since 2018. The Just Machines companies existed since 2013. And during that whole time, it has seemed that we lack competition and nobody's pushing back complaining that our list of the 24 big challenges of the human race that AI can help fix needs modification. Or yeah, that's just really interesting. So I wrote a poem about that. As far as we can tell, there's no competition at all, or we blew them out of the water. As far as we can tell, no one else is planning how stem cell generated organs can be created by AI, or making lists of the other big challenges for humanity that AI can help fix. When just for kicks, we pitched these projects in November 2023 to medical student prospects, the scale of patient benefit was 20 to 100-fold greater than in the other AI projects pitched. And when we returned to the pitch competition the next year, all the other AI guys were no-shows, never turned up there. I never imagined that happening. And it seemed we blew them out of the water in 2023. They were reluctant to return to the fray. Similarly, because of the rarefied field in which we operate, technology, poetry, uh-huh, um, sorry, um, our technology poetry offerings are uniquely human, not found in training sets and not AI creatable things. So our poetry, in addition to many intrinsic positive qualities, also has the distinction of not being possible to replicate by AIs. Now, the Just Machines company ultimately derives from the course that I teach at the university that I have taught since 2011, Technology and the Future of Medicine, LABMP 590. And if you're thinking of what practical things you could do to help us, one thing you could do to help us, if you know University of Alberta students, you could encourage them to join this course if they haven't already done so at some point. And it's kind of a unique course. It teaches about a future where machines are in charge and humans can only figure out what's going on if they collaborate or join with the machines in some way. And I thought when I began this course in 2011 that there'd be hundreds of similar courses at other universities, but there aren't. for whatever reason. It's another part of the rarefication. So there isn't another course exactly like this one. And some of the students get hooked. To some students, it's just an ordinary course and they take it and that's it. Other students get hooked and when the course ends, needs continuous link for the course. So it's really amusing that the number of TAs in the course is sometimes higher than the number of students because students who've already taken it want to continue a link with the course and so on. So that's a rather unusual feature. And the future and all that jazz, which you would recognize as now become a poetry and musical album that already exists in that Dropbox link that I sent you. That came about because people felt anxiety in the summer that there was nothing related to the course that they could do. So we created this poetry and musical offshoot. And so what we have been saying about the course is the teaching that I do here at the university allows me to meet up to 66 new young people per year whose creativity is our secret sauce. And one of them is kind of special. Haba Bahal is a second-year medical student who's been working with me since 2023. And she has been able to improve every big idea I've had during that period. And it's really a very productive collaboration. I have not met very many students who have that kind of mind that can improve anything I have to present very often, but maybe there are two or three others in the total history of my interaction with students. And so we began with 6 challenges of the human race, and then 12, and then 17. When we had 17, Marcus Hutter, well-known AI researcher in DeepMind, suggested we were so close to an all-inclusive list of the big challenges of the human race that why didn't we just make it all-inclusive? And he suggested unknown unknowns and other as a way to do that. So any item you guys might suggest, if you note is missing from the list, is not really missing from the list because it could be an other or unknown unknowns. The other recent thing that happened is Rich Sutton, who is my closest AI researcher contact, winning the Turing Award. This is a Nobel Prize equivalent award with a $1 million US cash prize. And Rich and I have worked together very closely since 2015. In the summer of 2015, we went to a sort of summer fest here in an Edmonton suburb, and they had spoken word poetry, and I went around and recited technology poetry, and Rich commented on it. We spent an entire day like that. It was really cool. And so you may wonder, how actionable is this list in 2025? I would say most of these challenges will require artificial general intelligence. So they're not really able for AI to solve them until approximately 2027, 2028. Some people put the date as late as 2030, 2031, but sometime in the next 3 to 6 years, we should be able to solve all of these challenges of the human race and others. And there will be common elements and spillover. And that's what Rich Sutton's bitter lesson that I've put the link here for. What that bitter lesson is very simple. That you're thinking any big advance that AI makes will build on what humans have already done in the same area. And that is generally not true at all, that most of the big advances have had nothing to do with what AI did before. And in fact, you may be aware of AlphaZero. So AlphaGo was the big breakthrough in the game of Go. And it was trained on humans playing the game of Go. But AlphaZero, which was simply trained by the algorithm playing itself in the games without any human data at all, was reliably able to beat AlphaGo. And there are many other examples of that actually giving human data slows the AI down, doesn't help. It isn't always true. So with AlphaFold, AlphaFold is a hybrid project having to do with protein folding and AI drug design. And it does depend upon human data. So it's one of the few AI advances that does depend upon human data. But because these 24 areas are very likely to be solved by AI algorithms that don't depend upon what humans have been doing in that area, means there'll be a lot of common elements and spillover. So once you solve one of these areas, it becomes much easier to solve others. Now, David Silver, who is the main protagonist in AlphaGo, was a student of Rich Sutton's, and I have identified him as the most likely person for me to interact with in the next short while, because I need a kind of credible AI person working right alongside me. And I think he could be that person. But there are a number of candidates for that. I've listed them here. They include Michael Levin of bioelectricity fame, Marcus Hutter, the guy who suggested making an all-inclusive list of the big challenges of the human race, and Emily Adlam, who's a physicist who specializes in all-at-onceness. You may think that time only goes forward. She'll tell you the time can go either forwards or backwards. But what's most important is to think of the concept of all-at-onceness, that maybe all the events you're thinking about could occur all at once. And you realize that we're going to have a kind of all-at-onceness when AGI comes. All the things that nobody is prepared to get AGI to fix, but that AGI could fix, will be competing with each other when we have AGI. It's going to be a very chaotic time. So that's why I've tried to say that we should prioritize ending the organ shortage in transplantation and have that clearly identified in health as the area we want to solve first when AGI comes. And I think in doing that, we will attract the attention of the DeepMind folks, and they may want to acquire the company. That's something that could happen. So what are we going to do between now and the time that AGI comes? Well, I think when thinking about this, I realize that I probably am a physician with more experience with poetry than any other physician that you know, maybe. Basically going back to 2006, when I took a course here at the University of Alberta on poetic medicine. And sort of, I've been working on poetry since then. And yeah, I'm very aware that the kind of poetry I create is very different from most. And that's cool now because in general poetry areas, you're probably aware that AI has been able to write better poetry than humans for a long time. But that's in areas that are in the training set. And the areas that I write about are not in the training set. So thinking that we need something for this interim period in 2025, 2026, we have already completed the poetry and music album. I sent you the Dropbox link for that, but that's a companion project with the poetry book that we're working on. And that I have been submitting 600 word chunks of the book, chunks of the poetry, to the 2025 CBC Poetry Contest, which closed on June 1st. So I will know if I'm long listed at least by November and probably before then. I do expect to be long listed, but we will see. But that would help people because a lot of people I talk to about poetry consider themselves not good judges of poetry because they don't like poetry, they don't deal with poetry, so on. So knowing that my poems have been long listed in this poetry contest would be useful to many people. So that's what we think would happen. Also, if you believe in the first mover advantage, I think it's become apparent that we fall in the category of first mover, and also that the rules may be different. If you calculate like what would be the value of a company that ends the organ shortage, that in itself is maybe a $15 billion company. And if you put all 24 together, you're probably dealing with more than $1 trillion in terms of the valuation. Also, I'm interested, I think for many of you, what I'm talking about, you don't see a role for yourself, but any of you who do see a role for yourself, I'm interested in talking to you. And, maybe we can end the rarefication that I have felt between 2013, 2018, and now, where we've been creating these ideas, getting bigger and bigger, and no one has reacted or pushed back or provided alternatives. Yeah. So this just summarizes these short-term work products. I've got poetic and musical album. You have the link for that I sent you 2 days ago. And so it's just 36 minutes. It's not hard to listen to it all. It fits well with the poems that I'm writing. Um, and we've identified 6 new purposes for poetry. And I think some of these are important and they have never been described before as purposes of poetry. Describe big ideas without giving away proprietary details, maintain oral tradition for things best not written down, avoid trigger words, promote pig to human transplant, end to the organ shortage, promote ideas not in the AI training set, and bridge the language of science to medicine oratory in addressing all the big 24 challenges. So, for instance, if you look at ending the organ shortage by creating stem cell generated organs, Michael Levin does not have any papers in medical journals. His papers in science journals, biology journals, and the language is different. And so it's useful to sort of cross that divide between science oratory and medicine oratory. And poetry is capable of doing that. Poetry is probably capable of other things I haven't listed here. And so beginning then, when AGI comes, we can begin trying to solve these 24 big challenges and giving priority to ending the organ shortage through a combination of AI and bioelectricity. So that's sort of the preamble. I'm now going to talk about the meeting in India where Agnes Fogo and I were competing for these two sides of the debate, whether we will still need renal pathologists and renal physicians or whether we won't. And you're probably interested in who won, but really the answer to that is that the machines won. There really wasn't a clear winner between the people. And that was also true in the debate about whether we need renal physicians, human renal physicians in the future. Now, how can you tell that the machine won? Well, you'll notice what's on the screen when Agnes and I decided to pose in front of our favorite slide from the presentation, got this interference pattern in the picture, which is the machine's way of messing with us. This is what that slide actually looked like. And it has to do with this idea that as we think more about the future, we need philosophers for the future. What's cool about philosophers for the future is many of them are women. There are not very many female philosophers in general in the history of philosophy, but there will be more and more as we deal with philosophy for the future. Now, I published a paper many of you would know in Kidney 360, talking about 90 years from now when everything will be automated. It's not just pathology will be automated, but renal medicine, renal surgery, anything you can imagine will be automated by that time. It's also comfortable because none of you plan to still be practicing medicine 90 years from now. So it's not competing with your personal wishes. And whether this automation might occur sooner, yeah, it's possible. This is the picture of a completely automated world optimized for human flourishing from that article. And you notice that I used Adobe Firefly. That's the only kind of AI I've been using. I'm not using any other kind of AI, but up until December 22nd, 2022, I was probably the physician in the world using open AI products the most and regularly and every day. And I was sort of hooked and I was writing a paper about it. And somebody suggested that my legacy, the legacy of Banff, was going to be wrecked by this fooling around with pictures that I was doing with Dolly 2. And I decided to simply stop the writing. So I just stopped, never went back to that. The other authors found this very, very surprising. But if you knew who it was that said that, you would kind of, oh my goodness, you know. so anyway, and the person themselves were really taken aback. They realized that I stopped writing the moment that they said that. So yeah, so my use of these products, I was using them more than anyone else before December 22nd, 2022, and really only Adobe Firefly since then. We've also got some cool song lyrics in that. You probably realize that. Okay, so how would this work then? This automated world, it's more negotiable than the world of today. If you wanted to talk with your physician, ask questions, modify plan procedures, and so on, there's sort of no limit to how long you could talk about this or negotiate about stuff and fine tune things. It's sort of like the movie Her, where the AI is able to maintain romantic uh, relationships with hundreds of men at the same time, right? So anyway, so there would be no shortage of time, and you would feel you're getting individual attention because the entity that you're interacting with would know everything about your case and so on. But it wouldn't be satisfying for everything. For end of life care, for celebration of major successes, you would still need to do that with people. It doesn't make sense you would do everything with machines. And this idea of curing all diseases is curiously linked to the Stargate project, to DeepSeek's sudden appearance, and all these things that have happened recently. Um, and it's really cool because it's so definitive. I mean, if you said curing some diseases, that would be one thing. But curing all diseases is really setting the bar quite high. And yet I think it is possible. So then you can think about our gratitude toward pigs and toward bioelectricity. We think that will be sequential, that xenotransplants, pig to human transplants will be successful first before stem cell generated organs, but will not be entirely satisfactory from a moral perspective or even practically. Sort of feel guilty every time you look at a pig or a picture of a pig. Yeah, it's not ideal, but eventually we will have stem cell generated organs using the patient's own cells. Be no problem with rejection. It will be much better where it'll have organs enough for everybody. That becomes then a wonderful extension of what I've done with the Banff classification. We'll need new classifications then, maybe at least 3 new ones, one for xenografts, one for tissue engineered organs, stem cell generated organs, and one for bioengineered organs. And humility required in both directions. We need to be humble because AI will be able to do things that would be impossible for humans without AI. But also, there will be some hybrid projects where AI is making success that builds on human accomplishment, and that also needs to be acknowledged. So you may wonder what the debate in India about the need for nephrologists in the future looked like. It was very interesting because it was all young people, young nephrologist network. So every picture I'll show you will be a young person, and these are some of the high points of that discussion. And it's true that they showed some AI generated pictures, of course. And they can imagine a role of AI in many different areas of kidney medicine. But some of the things they thought unsatisfactory might not be. I mean, this shows one of them. They think that AI counseling would be inferior to counseling done face to face with a real human. I'm not sure. It's not necessarily true in psychotherapy. It's been known for some time that a lot of people would rather talk to a machine than a real human. So yeah, and this idea that nephrologists who use AI responsibly will replace those who don't, yeah, I suppose that's true. But this idea that when you're talking about these things, never say in the future there will be no human nephrologist or no human renal pathologist. Never say that. Never allow your mouth to pronounce those words. Just doesn't make sense. Eventually, that time will come. And so I'm saying it's in 90 years. Now, Agnes had the idea that both of our presentations should have a humorous close. And this was her humorous close, talking about the movie 2001 and the behavior of Hal, and how could you possibly wish for a future in Hal's hands and that sort of thing. So that was her humor at the end. And mine was a time machine predicting the future job trajectory of colleagues that I knew well, and Brad and Lynn were two of them. And just thinking about, as I've said, it's really interesting how a lot of the philosophers of the future will be women and so on. So I predicted that Lynn will be a well-known philosopher of the future, that this is what she will look like at that time. And then what about Brad? So we'll also need renal pathologists on Mars. And so this is a picture of Mars as Adobe Firefly saw it. And so we're not sure why this looks so much like Brad, but it does. And so the time machine captured an image of Brad Ferris on Mars in 2032. You're probably also aware that the date 2032 is when the longevity escape velocity is supposed to occur. That advances in longevity will be such that if you can live to 2032, you can essentially live forever, because after that, the trajectory of scientific improvements is faster than your own aging. So you sort of keep on keeping on, from that point on of 2032. Now, 2032 is not that long from now, and we'll see if that's really what happens. Yeah. So Brad also is part of the Banff NIH grant that we have that is fully funded and funds are flowing, and we're planning now a phase 2. And the thing about those of you listening in phase 2 is we need more renal pathologists to join us for the phase 2 part of the grant. And if you're interested in that, please let us know about that. This is an Adobe Firefly depiction of what it thinks Banff is doing. Yeah. Now, what about Rich Sutton's Turing Award? I just wanted to point out that in theory, it's only a theory, but that gives me more gravitas, right? Because since I'm good friends with Rich Sutton, he and I are neighbors. When I'm out mowing the lawn, he comes by and I turn off the lawnmower and we talk and stuff. And my wife knows his wife and stuff like that. So, yeah. So, winning this Turing Award was a really major thing. And so you can talk about whether that major thing trickles down at all to the other people that he knows, but maybe it makes my beliefs and words a little bit more important than they were before he won that award. At least that's possible. And this is other details about the award in case you're interested. Yeah, and so on. And what he said, which I think many of you will find shocking, but he really believes this, there are no authorities in science. And one of the things that that might mean is, what about this polymathic kidney pathologist talking to you about AI now? Is that legitimate? Or should you only listen to AI scientists talking about AI? So if there are no authorities in science, then maybe I'm worth listening to. And he and I teach uh, together. You can watch the videos of that. So it's really been a fun relationship that I have had with him. One of the other things that's happened recently is a bit disquieting, which is young people on the net saying that the rapid advances of AI makes them feel like nothing they do matters. Every time I read stuff about AI, it gives me the feeling that nothing I do, hobby studies, anything matters. AI is just going to swoop in, do it 10 times better in a few years. Hard to be motivated to do anything, so on and so forth. And I think the real future for young people is entirely the opposite of that. For instance, if you're in medical school now, I think this is the best time to be starting a medical career. I wrote a poem about that. It's the best time to start a medical career. We're close to curing most diseases, eliminating fear, when most patients with life-threatening illnesses will survive and thrive, when we have the upper hand and to beat all diseases can connive. In the past, we could benefit only a portion of the patients we see. In the future, we will help most quickly and completely. Where in the past many diseases were deep mysteries, now we will know what we're doing and succeed almost always. We have a surplus of organs we can provide to the whole world. Imagine nephrology and transplantation expanding 20-fold. That's what we would do if we provide organs to everyone. In patient, staff, resources, and activity, situation ideal for you and me. Myriad options within medical specialties continue to expand. Doctors with entrepreneurial skills are now much in demand. Every major advance in medicine opens new career paths galore. Can be deeply satisfying to have a medical job no one had before. All in all, it's a great, exciting time to be alive. No better time to start a medical career than 2025. Yeah. And Haba, I just want to mention again this idea of new purposes from poetry. This idea came from her. Um, and so, yeah, although she's not here today because she isn't feeling well, but she is contributing quite a lot. And eventually, if we have a fully funded enterprise, there's sort of a cadre of about 28 people that I've accumulated in the course of preparing various grants over the years. And they're quite an interesting group of people, and they could all join us. And that includes a lot of young people and very talented students, young people, and a lot of graphic artists. Ashita Mogi and Chingyan Wong are just two of them, but some of you know this paper of Gary Nguyen and mine with these uh, illustrations that Ishita did, and so on. Yeah, so the technological singularity we used to think was 2035, 2045. People are now talking about potentially as early as 2026. So the cool thing about this talk today about AI optimism is you will all be impacted by this. And you'll know if I'm wrong or I'm right. So, I mean, it's not going to take forever to figure that out. One of the things that I'm also doing, also a part of, that you may find interesting, is an identifier, both visual and auditory, for what you're dealing with when you're communicating with something. Is it AI? Is it human? Is it human assisted by AI or AI assisted by human? And this has now been accepted by the standards community. And as far as I know, it is the only worldwide standard for this. And I can send you more about that if you're interested. Those of you who attended the Banff meeting in Paris in 2024 may have heard my presentation there on vascularized composite allografts. That's also very interesting in that I'm not aware of anybody else talking about that. In other words, stem cell generated composite allografts and the use of bioelectricity and so on. So it's once again one of these rarefied areas of intellectual inquiry where it appears there's no one else there. That's exciting in a way. And I've been dealing with what this means for quite a while now. So as we get close to the end, then I'm telling you that the future, particularly the future of ending the organ shortage, is first porcine, but then regenerative. Eventually, it will involve getting the right stem cells in the right places in a way that humans will never know how to do that, but AI will. And so it's just one of a number of things that AI will enable humans doing. And it may or may not build on Michael Levin's bioelectricity. So in lower animals, planaria, frogs, and so on, you can generate new limbs or new organs just with a bioelectric signal. And the body then knows what to do, knows what to create. Yeah, and it works a little bit in preliminary studies in human mesenchyme, but not in human organ generation generally. But you can imagine in some ways that success or failure would be an acceptable outcome. If I make a big pitch to DeepMind that ending the organ shortage should be their big health related hybrid project between 2028 and 2030, it would be wonderful if they say yes, but if they say no, that also has advantages in that it dilutes the intellectual property less, right? So when we figure out how to do this, we're then sharing with fewer people. And the same is true of with Michael Levin, without, so on. Every scenario you can imagine. But I kind of count David Silver in this as well, in that I think it would be good to have somebody well known for one of these advances. And since um, AlphaFold is his baby, it would be cool if he were an active part of what we're doing. So where are we now in this trajectory of stages of artificial intelligence? Well, you're hearing about agents all over the place. And so innovators, that is the idea of true discovery, big time discovery, discovery like Einstein. What Demis Hassabis says about discoveries like Einstein. If you take what Einstein knew in 1904 when he made his big insights, and give that to an AI, if AI then is able to recreate E equals MC squared, then we really have something, right? So, and they're predicting what Demis says is that will exist in 2030 to 2031. And that is true AGI, equal to any human who's ever been alive. And it, of course, goes beyond that. We'll then have organizations, companies where AI is completely doing all the work of the organization. And in fact, if you think back to JustMachines, of course, it's a question of how many people we need. We really have two active players now, Haba and me. People are talking about starting unicorn companies, companies worth over $1 billion with 2 or 3 people, because you can automate so many things and get agents to do so many things. So AI can invent the technology beyond human can. So just think for a moment about the details, what it would mean to end the organ shortage, would save over 1 million lives annually. And it seems like we need to get used to the idea that very soon we'll be able to do a lot of things we would never have been able to do without AI, that we'll be able to make advances way beyond what humans alone would have ever done. And that includes in these 24 areas that we have identified, that this is also consistent with the idea of precision medicine. We've been talking about precision medicine since 2015, but this would be a new, more powerful kind of precision medicine. Now, the things that humans will probably never be able to do, getting the right cells in the right places, probably aware of this paper of Song et al. From 2013, decellularizing and recellularizing rat kidneys. And they ended up with podocytes wandering around the interstitium looking for something to do, right? Well, that's not how it's supposed to work. So that's when you get the right cells in the wrong places. I think it's going to be very difficult for humans to decide how to fix this, but AI will be able to solve it. And similarly with the long loops of Henle. If you guys didn't have long loops of Henle, you would have had to go to the washroom several times during this talk. And yeah, it's not much of a life. But when you talk to people in the regenerative medicine world, they just sort of shake their heads about the idea of humans making long loops of Henle. But there again, AI will be able to show us how to do that. It's not true that we can't do it. We can't do it alone. Yeah. Okay, so in our original location, we had mule deer poking their heads into the meeting rooms. Now soon we'll have pig organs, stem cell generated organs in the operating room. Come a long way. You could contribute to this, and if you would like to, please contact me. That includes, even if you're watching the recording much later than the actual date of this June 5th presentation. Yeah. And any way that it feels natural for you to help us, we would be very happy to have help. On the other hand, as we've said, we can be pretty lean. We're currently operating with 2 people. We could have 3. Yeah. So anyway, that's kind of our feeling. We're not desperate for more people, but if there are people out there with ideas, with pushback, we've never had any pushback on what I'm currently presenting here. Yeah, would be good to eventually have some. Okay, so that is it. I'm going to stop sharing now and we can do some discussion. And we did that in less than an hour, which was cool. So we've got 4 minutes left.
That was great. Kim, that was really great. I really liked it. Lynn has a question in the
Okay. Yeah, Lynn.
Oh, I put it in the chat, but
Okay.
they asked, do you think that humans will lose their critical thinking skills with more and more use of AI? And where is the optimism in that?
Right. Sure. Well, what I currently feel and what I'm telling medical students, when I'm teaching medical students now, they're all on chat GPT, looking up stuff when I'm talking to them and so on. And think of your own autonomy and um, how you feel about whether your brain can be trusted to do important things, right? You should periodically turn off the AI, think your own thoughts, try solitude. There's a lot of good poetry and other kinds of writing about how wonderful solitude can be. People are talking about AI and saying you never have to be alone again. I don't think that's good. So yes, if you are never alone again, then you're always distracted from your own thoughts and you will lose skills. But if you periodically turn the AI off and then have some moments with your own thoughts and test yourself. Now, what happens if those moments are so boring? If you find yourself not entertaining at all, your brain never has content as interesting as the AI, then you can get third-party content. Content providers can fix that problem for you and stimulate your own brain through third-party content that is not AI, that strengthens your ability then to think things through. Yeah. So no, I think that's one of the most important problems now. And it's a problem with teaching young people or maybe just teaching people in every area. It's not just in medical school, but it's in all aspects of human endeavor that you find students who are not trying at all, who don't ever want to trust their brain to do anything, never want to be alone again, and want to always have the AI there so that they can take credit for what the AI does for the rest of their life. Natural or unnatural, you can talk about what kind of life that would be, right? And it's very interesting when you give a presentation about that to young people and then pay attention to eye contact. You lose eye contact kind of permanently for that hour with some of the people there. And they are the ones who've already decided to never turn off the AI, I think. So that's kind of scary, but you don't lose eye contact with them all. And I've still got eye contact with a number of you. So that's probably a good feature. Yeah. So anyway, that's my answer. I think the question Lynn asked is the most important question there is, and it's important in any group of people that you talk to right at the moment. Yeah, and humans can get better, of course. So and it's not just brain implants and so on. I'm sure there'll be lots of other ways. So we can use the challenge of AI. Think if you had a friend who you knew in every way this friend is more capable than you in everything, right? But they still enjoy your company, right? That'd be a cool sort of friend to have. You could learn from that friend and you would be smarter as a consequence of having such a friend. Well, that's what you have now or soon when AI knows more than you about most things. So the cool thing about poetry and me is right now, the poetry that I'm writing, I think AI couldn't write because it's not in the training set. But eventually, of course, even that, as soon as I write anything that's circulated to any degree, then it will be in the training set. And then, you know, then AI will be better able to write Kim Solez poetry than, you know, the man himself. So that day will come, but it's not quite there yet. And the same is true of anything that any of you are really good at the moment. And many of you are good at many different things. And so at the moment, you're better than AI at a lot of things. But the problem is that in the next 3 to 6 years, that will stop being the case. And so it doesn't mean AI is better than you, but at least it's a standoff, right? That AI will maybe be at least as good as you in all of those areas of your current strength. But in a way that makes it more valid to be trying to see what your brain can accomplish now in 2025, 2026, because there's more of a chance that in any competition you will win than there will be in later years as we get toward 2030, 2031, where Demis says that the Einstein equivalent will be reached. Somebody who with the same information could come up with E equals MC squared. Yeah, so when we're at that point, then it will be harder to win when you're competing with another entity. Yeah. Any other questions? Let's just see. Thanks for all the kind words that you guys said. I guess that's kind of cool. When you talk about rarefied, Lynn's was the only substantive question. So yeah, so that's all also kind of cool. Okay, do the rest of you have any oral questions? So what do I mean by the oral tradition? Well, let me tell you about something maybe that you'll find shocking. There's no question that there's less humor in kidney medicine writing than in any other medical specialty. You can prove that numerically. It would do no good to anybody to write a paper about that, to write that down, to popularize it, to do a lot of talking about it. I think when we end the organ shortage, that will fix itself because the well-being amongst people in the kidney field will go way up because they'll enjoy their work life much more, that have less untreatable chronic illness and stuff. And suddenly people in the kidney field will be the most fun to talk to, have the best sense of humor. Their writing will have the best sense of humor. Yeah, so that will be one side effect of ending the organ shortage. But there are lots of things like that. I don't need to mention them all, but when I mention the name David Crippen, think about the history that I had with him and why is it when we had a meeting in Pittsburgh that we didn't hear from him and so on. That is also a story that shouldn't be written down. There are lots of others like that. So, yeah. So anything else you wish to talk about? Thanks for staying the 5 minutes late. And yeah. No, I am very happy with all the people who are here. Parmjeet isn't still here, I think, but he was here and so on. So yeah, it was a very good turnout today. So I'm very happy with that. So anyway, I was, of course, there hasn't been a situation exactly like this before, so I was a little bit worried, and I am very happy with how it went, and I thank you for your participation. Yeah. So Lynn, I should tell you about our Friday rounds that you've also been invited to. Um, we really are enjoying having prominent outsiders there for those rounds. Interestingly, that's not true for nephrology grand rounds, which occurs beforehand. And, and so, and there are different Zoom links, but we find for the patient, pathology discussion that having other outside people there is very valuable to us. Okay. Yes, this talk will be not only posted on YouTube, but posted on YouTube soon. The only question is, will I keep it public? And I think that depends upon what happens. If I receive a lot of threatening mail and so on, then I might not. But otherwise, I think it probably would be public. Okay, well, I don't want to keep you any longer. So thank you very much. And Lynn, if we see you again tomorrow, that would be great.
Yeah, I'll
Okay,
be there.
cool. Okay, great. Thanks.
Thank you all so much. Thank you
Thank
so much
you.
for giving that talk, and thanks for those who could come.
Yeah,
Take care.
take care.
Bye.
Bye-bye.
Bye.